Hi, my name is Fatthi Abdelbaki from Alexandria, Egypt, and I'm going to present on the CT images of inner ear, the normal findings. I'm going to present it in the axial view, going by level from superior to inferior. In CT axial sections, starting from superior, we will find the first level or the level of superior semicircular canal. At level 1, we have three cuts. The upper cut, the superior canal will show as a line, and then the superior canal will show as two dots, snake eye appearance, and then come the level of the superior canal with the posterior canal will show in this cut. So three different cuts with different structures seen. Moving to level 2 in TT axial is the level which I will call the level of vestibule and lateral semicircular canal. What are the normal findings? At this section, we will see the lateral semicircular canal as a bucket handle. We will see the bony island, and it's important to note that the bony island should be more than 2.5 millimeter. We will see the posterior semicircular canal as a small dot, the vestibular aqueduct as a slit. It shouldn't be more than 1 millimeter at the midpoint or more than 2 millimeter at the operculum. The funnel-shaped internal auditory canal with the facial nerve coming laterally, the labyrinthine segment of the facial nerve. Just inferior to this level, there will be a level where the internal auditory canal and the vestibule will show. And there is a small part of the cochlea which will be here seen superiorly. Please note that this is a part of the basal segment. It is the superior segment of the basal turn. The basal turn, this is the inferior segment, this is ascending segment, and then the superior segment, then the descending segment. What will show the first part of the cochlea, which will show it's a part of the basal turn. It is not the apical or the middle, it's the superior segment of the basal turn. An important structure to look at this level is the tympanic segment of the facial nerve, and it is important to see if it's covered by bone or not at this level. Finishing with level 1 and 2, which usually show the vestibular system, the semicircular canal, we move now to level 3, which is from here we can see the cochlea, because you know the cochlea is anterior and inferior to the vestibular system. So in axial section, it will appear after the vestibular system. In this mid-modular level, it's important to see the cochlear aperture and to have the measurement of the cochlear aperture, which should be more than 1.5 or 4 millimeter. If it's less than that, it usually indicates some form of stenosis or possible cochlear hypoplasia. It's important also to look the modulus, if it's present, if it's abnormal or normal. And at this level, we will see the apical and middle turns of the cochlea, with the two horns of the between apical and middle turns and the modulus in the middle. At the same level, we will see the end of the posterior semicircular canal coming as a line posterior to the cochlea, and of course this is the vestibule. Just below the mid-modular level, we will see this level with the basal turn coming in appearance. The round window will start to show. There will be round window overhang, and here it will show the cochlear aqueduct will start to appear. And the cochlear aqueduct is parallel to the internal auditory canal, but at a lower level. Moving more inferior, we go to the fourth level or the basal level. In this section, we can see the basal turn of the cochlea and the jugular bulb, and you can notice that there is a space between them. But sometimes the jugular bulb is high, reaching to the round window, and it is important to notice whether there is bone covering this jugular bulb or the bone is dehiscent. By this, we finish the presentation on the CT axial view of the inner ear normal findings, and I hope to meet you soon in another presentation.